Well, the focus of the meeting is not only to discuss the activity of these agents, but how to manage the immune-related adverse events. Basically, that's what the focus of MASCC is, the Multinational Association on Supportive Care in Cancer. But these drugs have been a major breakthrough in the management, first with the metastatic malignant melanoma, then also with non-small cell lung cancer, which is very important. And now, as the title of my talk is and beyond, we have the new checkpoint inhibitors that are working on basically on patients with triple negative breast cancer, bladder cancer. We're going to start a study on ovarian cancer and also gastric. That's areas that we've been involved.
Yeah, and then obviously because it's a new therapy, it's not what we've seen with chemotherapy or targeted therapy before. That's why there's a big focus at the conference on immune-related adverse events, because the mechanism of action of checkpoint inhibitors are so different from the drugs we've used previously, so the side effect profile is also completely different. There's a wide range of toxicities that can affect basically many different organ systems, and we look according to frequency of adverse events, so what's more common and what's more rare. The meeting focused mainly on dermatological and gastrointestinal side effects, which are more common, and then some of the other more rare things like endocrinopathies and cardiomyopathies, pneumonitis as well, and that kind of thing.
One of the interesting points is that the first ones that we got involved with was the anti-CTLA-4 type of antibody to block that checkpoint, and those ones appear to be much more toxic than anti-PD-1 antibodies. So, and then there's also the combination of the two, blockade of the two pathways, which is associated also with more toxicity, that you have almost like a potentiation of the toxicity. So it is more active, but it's also more toxic. Now, one of the things, and you can corroborate also what we're discussing, is that some people think that these treatments are not, it's not that they're not toxic, it's different from the chemotherapy treatment, and people should be very well aware of how to manage these immune-related adverse events.
Yeah, so there's many considerations. So for instance, CTLA-4 inhibitors have more side effects than PD-1 inhibitors, also related to dosing. So we've seen in trials where you use bigger dosing that the adverse events are more, and like Dr. Rapoport said, when used in combination, also you see a more frequent adverse events also, and more severe as well. So, and the important thing about it is that people have to be aware that even though the side effects are transient, usually low grade and self-limiting, that they can be very severe and fatal in some instances as well.